Good morning. Welcome back to Open Med School. The last session we have discussed about an overview of acute liver failure. Let us have the recap, followed by the etiology of acute liver failure. So, coming to the definition, there should be an acute insult to the liver. So, there should be an acute insult to the liver, and this is usually evidenced by there is an acute insult to the liver, and this is usually evidenced by increased transaminases. And second is patient has got coagulopathy, and that is evidenced by increase in the INR more than 1.5. And third is there should be evidence of hepatic encephalopathy. These are the three major features of acute liver failure. But there are certain points to be again remembered that in order to say it is an acute liver failure, this should occur in a previously normal liver. So liver should be previously normal, and the duration time span is again important. It is less than 28 weeks. 7 days it is hyperacute or fulminant. Up to 21 days you call it as a acute, and 21 days to 28 weeks it is subacute liver failure. So the definition is, hope it is clear. So I will repeat once more. Patient should have acute liver injury evidenced by transaminase rise. There should be coagulation abnormality evidenced by INR more than 1.5 and features of hepatic encephalopathy. In a previously normal patient, and the duration should be less than 28 weeks. Again, few more points to just remember. When you say normal liver, some exceptions are there. One is a patient with a non-Wilson's disease. They can come with a, so even though there is a pre-existing disease, this is again acute. Second, somebody with a hepatitis B virus infection, they may again come, and sometimes autoimmune diseases. So these are the caveats that you should keep in mind. So once we understood the definition of acute liver failure, now let us go into the etiologies of acute liver failure. So basically we can divide them into one, hepatic parenchymal disease, that is liver parenchymal disease, and second is vascular disease. So it may be due to portal vein or hepatic vein or artery or anything, any problem with the blood vessel. So let us look into the parenchymal. Parenchymal can be divided into 5 groups. You can remember why. Mnemonic B, I, P, A, D. So that is the short form for it. So B stands for viruses. Hepatitis B virus is the number one. Then can be rarely hepatitis A virus, CMV virus, CMV, cytomegalovirus, Epstein-Barr virus, etc. I stands for infiltrations. Infiltration can be tumor infiltration like lymphoma. Then comes P is pregnancy related. Two important conditions. One is HELLP syndrome and acute fatty liver of pregnancy. A is for alcohol. D is for drugs. This may be idiosyncratic reaction in Western countries. Toxic dose of paracetamol or acetaminophen constitute around 45% of cases. Other drugs are substance abuse like cocaine, and toxin also you should consider the fungus or the mushroom, Amanita phyloides. So in that group, you should keep in mind this also. So second, we have said about the parenchymal disease. Now we go to the vascular. One is hepatic vein obstruction, the classical Budd-Chiari syndrome. This may be due to polycythemia, venoocclusive diseases, thrombophilic conditions. So this can lead on to hepatic vein obstruction. Next, very important is the ischemia to the liver. Ischemia, remember by the term shock liver. S stands for sepsis, H for hypertension, O for obstruction, C for cardiac, and K for combined combos. So ischemic liver injury is very important. It can occur in hypovolemia, hypertension due to any cause. So basically, we divide the causes into parenchymal problem, vascular problem. Parenchymal mainly 5 major causes are there. So today we have discussed about the definition and the etiology of liver disease as a recap. The next session will be discussing investigations and come to a diagnosis in acute liver failure. Hope it was useful. Stay tuned. Thank you.